Module Overview. This foundational module serves as the gateway to the entire phlebotomy certification program, laying the groundwork for learners to understand what phlebotomy is, how it evolved, what scope of practice it entails, and the professional, ethical, and legal responsibilities that guide certified phlebotomists in modern clinical environments. Understanding the historical trajectory of bloodletting to modern phlebotomy gives you critical context on why specific procedures, safety protocols, and ethical boundaries exist today. You also explore global differences in scope of practice, professional credentialing bodies, and cultural considerations in patient interaction. This module is vital in building a compliant, safety-conscious, ethical, and competent professional identity for future phlebotomists. First, history of phlebotomy. Phlebotomy, derived from the Greek words phlebos, vein, and tome, to cut, dates back over 3,000 years. In early medicine, bloodletting was practiced by Egyptian, Greek, Roman, and Chinese healers who believed that illness stemmed from imbalances in bodily fluids or humors. Key historical highlights: Ancient Egypt, 1400 BC, bloodletting documented on Ebers papyrus. Hippocrates, 400 BC, supported humorism, health based on balance between blood, phlegm, black bile, and yellow bile. Middle Ages, barbers performed bloodletting along with dentistry and minor surgeries, which gave rise to the iconic red and white barber pole, symbolizing blood and bandages. 18th, 19th century Europe and America, overuse of bloodletting declined due to poor outcomes. Rise of scientific evidence-based medicine took precedence. 20th century to present, bloodletting evolved into scientific phlebotomy used for diagnostic testing, blood donations, and therapeutic procedures, e.g., in hemochromatosis or polycythemia. Understanding this evolution helps phlebotomists respect both the art and science of the profession and recognize their role within the larger continuum of clinical healthcare. 2. Modern definition and purpose of phlebotomy. Phlebotomy refers to the act of drawing blood for laboratory testing, transfusion, donation, or therapeutic reasons. It is performed by certified phlebotomy technicians, CPTs, nurses, and lab personnel who are trained in venipuncture, capillary sampling, safety precautions, and patient communication. Main purposes include diagnostic testing, to check for disease, e.g., diabetes, anemia, infections. Blood donation for transfusion and plasma therapy. Monitoring, track effectiveness of treatments, e.g., warfarin, HIV. Therapeutic phlebotomy, to reduce blood volume in patients with disorders. Modern phlebotomy requires technical skill, attention to safety, regulatory compliance, ethical conduct, and excellent patient interaction abilities. 3. Scope of practice. The scope of phlebotomy practice may vary by country, region, and certifying body. However, a globally aligned scope often includes identifying patients and verifying lab orders, performing venipuncture and dermal punctures, labeling and transporting specimens, applying infection control protocols, managing patients with special needs, e.g., pediatrics, geriatrics, documenting procedures in patient records, responding to emergencies, e.g., syncope or hematoma, reporting equipment malfunctions and near-miss incidents. Phlebotomists do not typically interpret lab results, diagnose, or prescribe treatments, though they must understand test relevance and specimen stability. 4. Legal, professional, and ethical considerations. Professional conduct in phlebotomy is governed by informed consent, must be obtained before any procedure, verbal or written. Patient confidentiality, HIPAA, GDPR, etc. All patient data is to be protected. Respect and dignity. Patients must be treated fairly and without bias. Do no harm. Always prioritize safety, use appropriate equipment, and follow protocols. Accountability. Document all procedures accurately and report errors. Professional boundaries. Maintain respectful distance. Avoid overfamiliarity. Global phlebotomy ethics align with standards from bodies such as CLSI, Clinical and Laboratory Standards Institute, OSHA, Occupational Safety and Health Administration, WHO, World Health Organization, NAACLS, National Accrediting Agency for Clinical Laboratory Sciences. 5. International certification and regulatory bodies. Phlebotomy certification and licensure may differ globally. Learners should understand the following. 1. Region country. 2. Regulatory certifying body USA, NHA, AMT, ASCP UK, OFQUIL accredited programs. EU IVDR compliant institutions. Canada, CSMLS, CMLTO, Australia, TAFE and Allied Health RTOs. Learning outcomes for Module 1. By the end of Module 1, you should be able to describe the historical evolution of phlebotomy, define the modern scope, purpose, and context of phlebotomy, outline the professional roles and legal limitations of a phlebotomist, understand and uphold ethical conduct, informed consent, and patient confidentiality, recognize national and international certification standards and career pathways.